Good morning, everyone. Hello and welcome. I'm Nora Dunlap, Program Officer for the MAT Access Point Project and the Center. Thank you for joining us today. I am going to get us started because I know we have a lot of content to review and go over, and a really exciting webinar presentation. For those unfamiliar, the MAT Access Point Project aims to create a network of organizations throughout California to address the opioid crisis by supporting prevention, education, stigma reduction, treatment, and recovery services for people with opioid use disorder, substance use disorder, and by importantly increasing access to medication-assisted treatment in communities. So throughout this project period, we're offering several technical assistance webinars for partners to access as resources, and the recordings are all available in the online portal. So this entire webinar is being recorded, and along with the slides, it will be posted in the online portal under the resource page. If you have questions throughout the webinar period, you can send them at any time via the chat box found at the bottom of the webinar screen. We'll sort through them and we'll address them as many as possible throughout the webinar and at the end of the webinar as well. It's truly a privilege for the Center and the MAT Access Point Project to sponsor this webinar, providing an in-depth look at relapse prevention that describes and provides an experiential and didactic introduction specifically to mindfulness-based relapse prevention. And with that, I'd like to introduce and welcome Dr. Neha Chawla. Chawla is one of the co-creators of Mindfulness-Based Relapse Prevention, is the co-author of Mindfulness-Based Relapse Prevention for Addictive Behaviors, a clinician's guide. She has facilitated numerous groups in private and community treatment settings and has conducted therapist training workshops internationally. She has authored several articles and chapters related to using mindfulness for the treatment of addictive behavior, and is also the founder and director of the Seattle Mindfulness Center, which offers mindfulness classes, community meditation groups, and empirically supported mindfulness and acceptance-based treatments. Neha, welcome, and I turn it over to you.
Thank you so much, and thank you everybody for joining me here today. This is an interesting format since I can't meet all of you and hear from you directly, but I look forward to pausing throughout this presentation and responding to your questions. So I wanted to start with just offering a little bit of a roadmap for where we're going to go today, and we'll just briefly touch upon behavioral treatments for substance use disorders and mindfulness-based interventions more broadly, and then we'll spend a lot more time on the theory for MBRP, why it might be useful in treating addictive behaviors, describing the content and the structure of the program. I'll walk you through several of the practices and exercises that are part of the program, and then also share a little bit of the research that we've done and others have done on it. So just in terms of behavioral addictions for treatments, this is probably familiar to all of you. There's many, but perhaps the kind of most foundational ones are motivational interviewing and cognitive behavioral therapy. And the reason I point this out is just to say that both of these treatments are also foundational to the development of this program. I'll say a little bit more about this later, but the style and approach of motivational interviewing definitely informs aspects of the philosophy and the approach for this program as well. And really it was designed as an integration of mindfulness and cognitive behavioral therapy, relapse prevention skills. So relapse prevention specifically, the research does demonstrate that it's an effective treatment, not just for a range of substances, but for other addictive behaviors as well. One of the more kind of important findings around relapse prevention has been that it may not always prevent a lapse from occurring, but seems to be effective than other approaches at delaying and reducing the duration and intensity of a lapse when it does occur. So shifting over to talking about mindfulness and mindfulness-based programs, really this whole mindfulness movement started with mindfulness-based stress reduction that was developed in the late 70s. It was the first program to take secular mindfulness practices and turn them into a behavioral intervention. And then mindfulness-based cognitive therapy for depression followed suit and used the same structure and format, but integrated it with elements of cognitive therapy. Both have a strong foundation of support at this point, and are comparable to a lot of other active treatments. And this is just, you know, mindfulness is popular these days. You kind of see it in the popular media quite a bit, but this graph, I think, is quite dramatic because it shows you the increase in research on mindfulness just in the last 10 years. So the bottom axis is year, and as you can see, even 10 years ago, there was very little research happening on mindfulness. And then in the year 2018, there were 842 published studies on mindfulness. So shifting over to MBIs, or mindfulness-based interventions for addictive behavior, there's only two that I know of that address mechanisms underlying addictive behavior. So MBRP, which is what I'm going to be talking about, and then one other one called mindfulness-oriented recovery enhancement that has some similarities but also quite a few differences. So MBRP is the thing that I have been most closely involved with, and we really started to conceptualize this program in 2006, which is when I was still in graduate school and working with Dr. Alan Marlatt, and we received a grant from NIDA, the National Institute on Drug Abuse, to develop and pilot test a mindfulness-based program that integrated mindfulness meditation and relapse prevention. So before we get too much further in talking about the program, I'd like to just introduce mindfulness. And again, this may not be new to many of you. You might have read, practiced, you know, tried mindfulness or meditation in different ways or places in your life. But I think it's helpful to get on the same page experientially when talking about mindfulness. So I'd like to start us off with doing a brief meditation exercise together, if you're willing. And then once I guide you through the practice, we can pause, and I'd love to take some comments and hear about your experience with it. So wherever you are, if you could find a spot where you can sit comfortably for the next 5 minutes or so, and maybe find a posture too that feels supportive to you. So if you're sitting in a chair, having your feet flat on the floor, and making sure your spine is straight but not stiff. And then if you're willing to close your eyes for a moment, you can. You certainly don't have to, whatever you're comfortable with. But I'd like to invite you to just for a moment bring some attention to your mind and body as they are right now. So you might start by just noticing the state of your mind. If it's busy or there's thoughts about what we're doing or what's coming next. And then seeing if you can turn the attention to your body. Perhaps just becoming aware of your body sitting here, the sensations of your back against the chair or contact with the chair or the floor. Maybe you notice places in the body that feel tight or creaky. And then I'd like to invite you just to bring your attention, to gently guide your attention to your breathing. So maybe even just making contact with your next breath. And you might notice where in the body you feel the breath right now. Maybe it's in the belly or the chest. Perhaps under the nostrils. So you may even pick one of these areas to anchor your attention to. And all we're doing here is noticing and observing the sensations in the body as the breath enters and leaves. It might be that slight stretching with an in-breath, falling with an out-breath. And you're going to notice very quickly that the mind tends to drift away from the breath into thoughts, ideas, stories, maybe judgments of how you're doing or what you're doing. So when you notice that the mind has drifted away, the instruction here is to gently, without force, just invite it back to the next breath. Once again, making contact with sensations of breath. In breath, out breath. And when you notice that the mind is off in the past or the future, inviting it back and beginning again. So you might notice where your mind is right now. And then as you're ready, you can allow your eyes to open if they're closed. And let's take a few moments if people are willing to share just your observations with that brief mindfulness practice. And Nora, if you wouldn't mind helping me facilitate viewing those.
Absolutely.
Thank you.
If you're able and willing to enter those comments in the chat box, I will share them with everyone.
So just what you noticed about your body, about your mind, what was interesting to you.
One comment is, it reminds me how often I don't check in with myself.
Mm-hmm. Mm-hmm. Yeah, and I'm curious about if that was a thought that was coming up while you were practicing, the person who made that comment.
Other comments, it was so relaxing and feel peace inside me. Another one, made me feel relaxed and have a quiet mind for a few minutes.
So some
comfort,
settling
comment,
mind and relaxation in the body seems to be a common experience. Yeah. Are there other comments?
Not at the moment.
Okay.
Oh, one more. Oh, yep, here we go. Sorry. I felt really relaxed and drifty. However, my thoughts kept going.
Yeah.
It reminded me that I forget to breathe. I become so wrapped up in what to do at work.
Yeah.
And it felt good and reminds me how quickly I can change my thoughts and physiology.
Mm-hmm. So thank you for those comments. And if there's more, feel free. Pretty kind of typical reactions, you know, that feeling of relaxation in the body, and actually how quickly we can access that. And also just that tendency of the mind to still keep going into thought. I see another comment over here. I don't know.
Yes, a couple more. It helped me center myself and get ready for the day. It was how she was able to bring us back in the moment, and it was relaxing.
Thank you. One more question, if you know people are willing to put this into the chat box. If you were to say, based on just your own experience with that little exercise, how you would describe mindfulness, what would you say?
One other previous comment, I was unable to practice today, being patient with my anxiety levels and being kind to myself.
Thanks for sharing that. So yeah, if people have any words about what you think mindfulness is based on just your little experience there.
The comments include awareness of mind. I'm thinking of myself as well. Awareness of what the mind is up to. A way to recharge. To be aware of myself and my mind in the middle of all the chaos the day brings. Spiritual moment and peaceful mind. Reconnecting. Getting tuned in with your entire self, mind, physical, and spiritual being.
Thank you. So just to illustrate I see another comment here, reminder that we are in control. Thank you for that. So just to illustrate what we did here, it's very simple. We brought some awareness to our bodies, and then we kind of anchored that awareness to an object, in this case, the breath. And then for most of us, probably noticed how our attention tends to wander away from the breath, usually to thoughts or sounds or other sensations. And then what we're doing with this practice is just noticing that wandering and coming back to that chosen object, which is the breath. So there's an element of paying attention, and lots of people mention this idea of awareness of your mind, being in the present, bringing your attention back to the present. And then one final piece that I think is an important piece here is that this whole process, the way we engage with it is not with sort of evaluating anything that's happening as good or bad or right or wrong, but this really kind of non-judgmental or even friendly attitude that's cultivated in this practice. Here's just a definition of mindfulness. There are many, but kind of returning to those core components that some of you already pointed out, the awareness piece, the actual monitoring of your thoughts, and then also emotions and body sensations, and that returning awareness to the present, so not, or disengaging from that perseveration on thoughts about the past and future, and doing all of this with this kind of attitude that's non-evaluative or non-judgmental. So let's take what we just did and apply those same qualities to thinking about addictive patterns of behavior. And if we were to reflect on those qualities in relation to addictive behavior, let's start with attention, this idea of paying attention or cultivating awareness. Can you hear me?
Yeah, I can hear you.
Okay, great. I saw a comment there, something about the audio. So this idea of cultivating awareness of our experience, our internal experience, as well as what's going on situationally, including things that might be triggering and our reactions to them. And then in this process of cultivating awareness of internal experience, we're learning to discern between thoughts and feelings and urges to act. And this might allow the ability to pause or interrupt behaviors that are otherwise automatic. The present moment component of mindfulness, returning to the present, might allow a way of being with things that are happening in the present that are uncomfortable, including thoughts and feelings and sensations, instead of running away from them. And then this non-judgmental quality, which might help unhook from some of the automatic and very self-critical thoughts that are often involved in the process of addiction or relapse. There is a little bit of research to show that these qualities are in fact associated with or negatively associated with substance use and with craving, and more positively associated with the ability to disentangle our attention following exposure to addiction-related cues and to recover physiologically from those exposures. So taking all of that and bringing it to the MBRP program, here are some of the core intentions of the program. And the first one is to cultivate awareness of our thoughts, emotions, and body sensations. And once we kind of are building the muscle to be able to do that, extending it to situations that might be triggering or elicit reactivity. The second intention is to help shift from responding to reacting, so interrupting those autopilot behaviors and allowing people maybe a little bit of a sense of space or choice. Another core intention is to practice another way of being with experiences that are uncomfortable. And this is a really central part of the program. So, such a hallmark of addictive behavior is fleeing or avoiding things that we don't like, that we don't want to be with. And in this practice, we're sort of stretching our ability to stay with and observe gently things that are uncomfortable. And with that comes perhaps a little bit more self-acceptance, self-compassion. And then final intention of the program is just to integrate all of these practices into a lifestyle that's better aligned with recovery. So to say a little bit about how this program is structured, it's based on mindfulness-based stress reduction that was developed by John Kabat-Zinn, originally for people with chronic pain, and then mindfulness-based cognitive therapy for depression as well. Both of those programs, like this one, are 8 weeks, although there's a lot of modified versions of this program that are being used in different settings now as well. But the original structure is 8 weeks, 2-hour sessions where you meet with people weekly and then encourage and provide resources for integrating these exercises into day-to-day life during the week. So again, if this is done within the context of like an inpatient treatment program, for example, it might look differently. And as I said, people are modifying the program for a lot of different settings. The practices in the program include both what we call formal mindfulness practices, so kind of like what we just did, doing an actual meditation practice, with some guidance, sitting for a set amount of time, taking that time out of your day-to-day. And then also informal practices. And these are things that can be more woven into day-to-day experiences, including situations where you might find yourself feeling triggered or reactive in some way. And then also there's some cognitive behavioral coping strategies that are part of the program. So just to say a little bit about the overall approach, it tends to be very experiential. The groups, it's usually conducted in a group format, group setting. They're not really process groups. People aren't sharing a lot about their histories or stories necessarily. It's much more like a class. We're doing these exercises and practices together, and then asking people to share their experiences in the moment with these things. What was hard, what got in the way, what felt uncomfortable, what they noticed about their minds and their bodies. And with that, there is kind of an emphasis on what people are noticing in the present. And when they're kind of going, away from that and into storytelling, there's a real effort to kind of bring it back to present moment experience. I think a central feature of all mindfulness-based interventions is the importance of the facilitator's own practice, which really allows for modeling some of these qualities that we're asking people to cultivate in their own lives. So modeling an attitude of non-judgment, of curiosity. And this is where I think the spirit of it is similar to motivational interviewing. It's very collaborative. There's no, I'm the expert, I have things to teach you. It's much more, okay, like, let's learn. My job is to be a facilitator. Your experience is your biggest teacher here. It's not very directive in that sense. There is a clear sort of framework, but within that, people are invited to have a sense of agency around, what they'd like to get out of this for themselves. So much more eliciting versus teaching, and the assumption is that the motivation and the kind of sense of agency, freedom, choice all lie within the person. Another component of the program is something that we refer to as inquiry, and this is the discussion that follows each exercise and practice. And there is a structure to this. It often involves highlighting the individual's direct experience in the moment versus the stories or the judgments that their mind is telling them. So just to illustrate that, for example, we've just done a meditation exercise, and the facilitator might ask, okay, what did you notice? And someone says, I can't do this. It was too hard. And the inquiry process would involve asking, okay, let me ask you what actually showed up for you. What was your actual experience in the moment? And maybe they say, well, I was experiencing a lot of pain, or I just felt really sad or uncomfortable. And it might take a little coaxing to sort of bring people to this, but this is kind of repeatedly what we're trying to do is like, okay, what actually happened in your experience? And the idea here is separating, the thoughts from the raw experience itself, and then relating this whole process to the process of relapse. So, outside in the world, this experience might replicate. People have the idea of like, okay, I need to just check out, I need to drink. But if they look more closely at what's actually happening for them in the moment, maybe it's an experience of discomfort or sadness. Another piece that happens in the inquiry process, especially in a group setting, is people may be starting to see that this whole process is not personal to them. It's not that there's something that's specifically wrong with them, but rather this is kind of how our minds work. It's kind of a more human experience, which takes some of the shame, perhaps, and the stigma out of it. So I'm going to go a little bit more into the specific content of the program, but before I do that, just to pause here for a moment, and I'd be glad to take any questions that are coming up for people about what we've discussed thus far. And if there aren't questions, I can keep going and we'll take them later toward the end. But if you have any burning comments or questions, feel free to share them in the chat box.
And we did get a question. I was curious how those who are dealing with normal dopamine levels can process such information.
I'm not sure I completely understand that question. Is it sort of distinguishing people who have normal dopamine levels from those who don't?
I think so, because the second part was done, or those who do not have normal levels, maybe.
And what information are you referring to specifically?
Ken, are you able to provide a little bit more context to that question?
The part about processing such information, I'm wondering what you're referring to there.
I think he's entering some more context in text.
Thank you.
And the rest is, from what I've heard, is that those cannot benefit from therapy if they are not normalized first, so if their dopamine levels aren't stabilized, maybe.
Yeah, I mean, I can't tell you, exactly what's going on in the brain. I'm not a neuropsychologist, but it's an interesting question, at least to kind of hypothesize about, something we can hypothesize about together. And that's exactly what I'm doing. I don't know how much research is actually out there on this. I think, I know a lot of the work that this group is involved with is around opioid use. There's only a couple of studies that I know of. I think they're usually utilizing this program after people have had some time with treatment and abstinence, so not right away. And probably in most instances, this wouldn't be the first course of treatment. It really is designed as more kind of relapse prevention or slightly later stage for one. So that's one part of my answer. And then the other is, there is a fair amount of science to suggest that meditation practice, sustained meditation practice over even 8 weeks does impact some changes in the brain, including perhaps in the reward pathways. So that is interesting too, along with the idea of neuroplasticity. So maybe there's something about meditation practice that is rewarding or rewiring the brain in some way as well. But I really am not qualified to speak too much about that. Any other questions before we keep going? Okay, I'll just keep going and then we'll pause again in a little bit. Here's just the overall themes of the sessions. So 8 sessions, this is what they look like. It starts with just an introduction, experiential introduction to, autopilot and the contrast of that with mindfulness, and how that might relate to relapse. And then we start to shift that awareness to triggers and craving. Use practices to integrate mindfulness into day-to-day life, including high-risk situations, and then get into working a little bit more with emotions and thoughts, and then finally overall lifestyle and ways to continue the practice. So, first few sessions focus on increasing awareness and then integrating and applying more specifically to high-risk situations in relapse, and then self-care and maintenance. So as I mentioned earlier, there's formal practices and informal practices. Here's examples of the formal practices that are part of the program. One that we do in the very first session is a body scan practice. So it's really just moving your attention very simply through the different parts of the body, just to kind of get accustomed with what's happening in the body. It's just like, okay, noticing sensations in the feet and noticing sensations in the legs or in the torso, what's happening in the face. So really kind of bringing people's awareness to their bodies. In session 2 and the next few sessions, it shifts to a sitting meditation practice, which is essentially what we just did together. It begins with anchoring attention to the breath, which is then used as a foundation to extend that awareness to, once again, sensations in the body, to emotions and how those are being experienced, and also to thoughts, which tend to be the hardest ones to really observe for people. But we kind of want, each one builds on the previous one. 2 other formal practices that are a little bit different. One is called the mountain meditation, and this is more of a guided imagery or visualization practice. So imagining a mountain and seeing if you can sort of embody those qualities. It's a practice that's really helpful in the face of big emotions or feeling really stirred up or overwhelmed. A lot of people tend to gravitate towards that one. And then finally, we do something called loving kindness or kindness meditation. It's really choosing some phrases, words to say to yourself, to wish yourself well. And this practice is really about actively cultivating a more friendly attitude towards yourself and your experience. Here's examples of some of the what we call informal practices. Some of you might be familiar with the urge surfing practice from other treatments, but it's really kind of like an imaginal exposure practice where you're thinking of a situation where you might have a craving or an urge, but practicing staying with it, noticing it, and really staying until it starts to kind of lose some of its power without acting on it. And the other is a kind of breathing space pause that people can insert into day-to-day life. I'll go through these more directly. See, I'm going to shift into some of these practices. So here are 2 practices specifically for working with urges and craving. Urge surfing, as I mentioned, and something that we refer to as the false refuge exercise, and I'll walk you through these. So urge surfing, the idea is to think of something that is slightly triggering, slightly evocative for you. And we do this pretty early in the program, which, might be a little bit tricky for some people. But the way we do this is really we don't start with a substance trigger. It's asking people, think of just something in your life where you have some reactivity. And if you're thinking of, 10 being your biggest trigger and 0 being not at all, pick something that's a 2 for you. So something that just kind of gets you a little bit. And then we're going to practice using that as an example. And then what we're practicing, as I said, is staying with the experience of discomfort that creates. The feelings that show up, the sensations in the body, and really observing them while using your breath as an anchor. And the assumption is that if you do this, it will start to subside on its own without any action on your part. Because usually when people are triggered, of course, they think that, they have to do something to fix it. So if this is an urge, over time, the expectation that people have is if you don't do something to end it, it's going to just keep going up and up and up and up endlessly. And in reality, it's more like this. So it might go up and up and up, but at some point it peaks and then starts to subside. And maybe it doesn't go all the way down like that. The graph is way too neat. But it does tend to start to ebb and flow a little bit more. And over time, the idea is that if we can keep practicing this, perhaps those waves get smaller, or even if they don't get smaller, we learn that we have some capacity to tolerate them. So again, I'm just going to pause here for one moment if anybody has questions or comments specifically about that. Okay, I'll keep going. Here's another practice exercise for working with cravings and urges. So the idea here is thank you. Somebody said that's a helpful practice, so thank you. It builds on the urge surfing, and the idea is we're asking people to shift their attention from the thing that they're craving, so the substance or the behavior, and shift towards what they actually are needing or longing for in that moment. And when asked to reflect on that or pay attention to that, people will often come up with things like freedom or connection or a sense of peace or relief or joy or and the idea with this practice is highlighting how these qualities are wonderful and very human desires, and there's nothing wrong with them. Because oftentimes, people are terrified of craving and experiencing it, but this practice is about kind of looking beneath the hood and seeing what's actually driving it and saying, well, there's nothing wrong with the things that you're longing for. You're just kind of looking in the wrong place. And so then asking them after this, what is it that you actually end up with? What is it that you actually get? And of course, what people usually get is the opposite of all of these things. So it just kind of helps to illustrate how the behavior is not addressing the underlying needs or longings, and that those needs and longings are worthy of care and attention, but perhaps in a different way. So here's another sort of brief exercise that is introduced and people tend to use a lot. It's called the sober breathing space. It's just a little acronym. And you can actually try this with me as I walk through it because it's very brief. So the first step is, when you notice yourself either starting to be reactive or impulsive or just on autopilot, the first step is just to stop. So you can try this even right now, just to stop, pause right where you are. And then the O, which is to observe what's happening for you in this moment. So just to turn the attention to the body and mind. So maybe noticing what your mind is doing right now. If there's any emotional tone, any feelings that are here. And also noticing what's happening in the body, if it's revved up, if it's restless, if it's anxious, relaxed. And then to collect your attention and just bring it to 1 or 2 breaths. So just to bring it to the next breath. And nothing else, 1 more breath. And then allowing the attention to expand. And now having paused slightly, seeing how you would like to respond versus react to the situation that you're in. So again, a very brief exercise, and if you've tried it, you can see for yourself sort of what you noticed in doing that or how that felt. Is just a way to insert a pause into day-to-day experience. Okay, so just to give you a couple of examples of some of the more CBT type exercises in the program, here's one. It's a noticing triggers worksheet. And so people might be tracking during the week, okay, what situations came up for me that were triggering today. You know, say I had an argument with someone, and when that happened, what sensations did I experience in my body? Maybe there was some tightness or heat or sweating or increased heart rate or feeling shaky. And what emotions did I notice, you know, hurt or anger or fear? And then finally, the thoughts that I observed and what I did or didn't do. And the idea here isn't to evaluate the choice as good or bad, but really just to notice what the habitual tendency is in those instances. So this is another tool for supporting awareness, for discerning between thoughts, feelings, and sensations, and for really becoming more aware of triggering events. Here's an exercise called the relapse chain, and this is something that is done a little bit later in the course once people have had some practice with noticing thoughts and recognizing thoughts as not being just absolute facts or truths. So we might ask someone in a group to share an example of a situation where they might have had a relapse, and really draw it out, and then, you know, other people in the group can kind of jump in as well. But really draw out, okay, what exactly happened here? So say there was a situation that was triggering and there was some kind of reaction to it that was outside of your control, and then what happened? So step by step, really illustrating this. And this is drawn on the board in the group. It doesn't look as neat as this. So this is kind of a very clean version. It's often a lot more messy. But the idea here is to illustrate the different pathways that might occur in a situation like this. So, you know, okay, it felt like things were on autopilot, you bought into the thoughts, you know, that I can't do this, and that led to some use, and then there was more thoughts, more reactions, and that kind of fed into this cycle of believing those thoughts and additional use, and then the cycle that we refer to as relapse. And again, like I said, it doesn't always look this neat, but some of the elements that tend to show up pretty reliably are that there is often a fork in the road, and different pathways, different possibilities. You know, if we are able to sort of pause long enough to observe our reaction, there is the possibility of choice. And that often when relapse does occur, there is a sense of automaticity. There is sort of some buying into our thinking mind that happens. And then this piece of the abstinence violation effect, which is from the relapse prevention literature. And there's quite a bit of support for how this kind of increases the intensity of the relapse, if you will. So this is, you know, when your mind is saying, oh, I've already messed up, like I've already started. Why stop now? Why bother? I've already failed. And how dangerous that thought can be in sort of worsening the overall outcome of the behavior. So I'm going to shift into just talking through some of the research on the MBRP program, but again, want to pause here for a moment to see if there are comments or questions about the content or any of the exercises that I mentioned. And I'm happy to review them if you'd like as well. We did the relapse chain, urge surfing, the SOBER acronym, and the false refuge exercise, where people connect with what they're actually needing in the moment. If there's questions about any of those, or anything else for that matter. And if not, that's okay. If you need time to reflect on all of it, we can keep going. I'll have more time at the end for questions as well. So I wanted to share a little bit of the research on the program. As I mentioned, you know, we first started developing this program in 2006 as part of a grant to come up with it and pilot test it. And we did this pilot study at a treatment agency in Seattle, it's a publicly funded treatment agency. And it was for people who had just completed either inpatient treatment or intensive outpatient treatment. It was for a variety of different substances. I don't have a slide on this, but I believe there was about half of the group was there for alcohol use, and then the other half, it was a mix of a variety of substances. And people either received the MBRP treatment for 8 weeks or continued with their treatment as usual, which was mostly 12-step participation and some kind of process groups. And then we kind of asked them some questions afterwards and a couple months later, and basically with that study, we found that it was feasible to do this kind of thing at a treatment agency, and that people did demonstrate greater awareness after the program in the MBRP group compared to treatment as usual, reduced craving, lower rates of substance use. We also found interesting finding that the effect of the treatment on substance use was mediated by reduction in craving. So people who participated in MBRP maybe had lower levels of craving and thus lower levels of substance use. This has been perhaps one of the more interesting pieces in the research on this program around depression, craving, negative affect. And I'll get into this a little bit, but what we found in that first study was that the MBR participation in the MBRP program attenuated the relationship between depressive symptoms and craving, and that this led to lower levels of substance use. So basically, people who were experiencing depressive symptoms were having less craving after participating in MBRP and thus less substance use. And within the treatment as usual group, craving was still resulting, or depression was still resulting in craving and thus substance use. So something was happening in this program where it was shifting the relationship with negative feelings or depressive symptoms and craving and substance use related to that. So just to get into this a little bit more, it basically ties into the self-medication hypothesis that people use substances to manage difficult feelings. There's research to suggest that negative affect is associated with relapse following abstinence, and that a lot of people with comorbid depressive and anxiety disorders have substance use challenges as well. Depression is strongly linked with craving and with relapse. So this is interesting and useful that this program in particular seems to target that self-medication piece. Here's another study that was done with people who are stimulant dependent and comparing MBRP to a health education condition. And it found that people who participated in this program not only had greater reductions in negative affect and psychiatric severity, but that those people who met criteria for depressive and anxiety disorders had lower odds of using stimulants in response to them. So here's a larger randomized control trial. It's the only one that we have been involved with. And this one was over a longer period of time. It was done at the same treatment agency that I mentioned earlier, same population, but over a longer follow-up period, a bigger group of people. And this time we had 3 conditions, the mindfulness-based relapse prevention, cognitive behavioral relapse prevention, and then treatment as usual, which was still 12-step participation and process groups and some psychoeducation type groups. And we found that there wasn't much that was going on at the 3-month follow-up, no differences between the groups. At the 6-month follow-up, both the MBRP condition and the relapse prevention condition seemed to do a little bit better than treatment as usual. So there was a higher probability of abstinence. And then among the people who did drink, lower instances of heavy drinking. the relapse prevention actually showed some benefit over MBRP in terms of a longer time to first use following abstinence. And perhaps the most interesting finding was this kind of delayed onset effect at 12 months, where it seemed like people who did the mindfulness group at 12 months, so later, had a higher probability of not engaging in heavy drinking and fewer days of drug use. So it seems like there was some benefit that happened over time, which suggests that maybe MBRP has some kind of enduring effect beyond 6 months. We don't know what that means exactly, but one of the hypotheses is that over time, and perhaps with greater exposure, greater time to practice, participants might be better able to become adept at recognizing and tolerating craving and negative affect, so less likely to use in reaction to it. So that was our hypothesis based on the results of that study. I wanted to share because it relates more directly to, it seems like, the work that many of you were involved with, but a couple of studies, there are only a couple, but using mindfulness-based relapse prevention for opioid use. This one was used in the context of medication-assisted treatment for opioid use. So people were in an opioid addiction treatment program in kind of the intermediate stages of medication-assisted treatment and had at least 90 days of abstinence. And it was a small study. It was only kind of pre-post, but it did indicate significant reductions in depression, increase in mindfulness, not quite for anxiety. It was only trend level, and not for craving. So there wasn't a reduction in craving in this group, but it suggests that maybe MBRP can be incorporated into medication-assisted treatment in an outpatient setting, which this was. Here's one other study that I found that looked at MBRP versus treatment as usual for patients who are being treated with methadone, where people were randomly assigned to methadone treatment versus methadone plus MBRP. And it seems like the MBRP group, compared to the methadone only condition, did indicate a decrease in impulsivity and relapse frequency. So again, there's minimal research on this, very, very early stages. Perhaps there's a little bit of promise there. So I just wanted to share that. And that is all that I have to share with you. I'm happy to spend time on hearing and answering your questions. And here are a few resources I wanted to offer, but maybe let's do some questions first, and then I can close with sharing a couple of resources if people are interested. So please feel free to type your questions or thoughts into the chat box.
Thank you so much, Dr. Chawla. And as people are, sitting with their questions and typing them in, I just am so appreciative of your time and presentation. And I think it gives us additional tools and considerations, not only to integrate into our own lives or our practices or with community, but also just for conversations and ways forward. It's really additional tools for us to use as we, navigate this landscape.
Thank you so much.
So we have Thank you from the audience as well.
Thank you.
And if you have any questions, feel free to jot them in the chat. If, you know, it's a lot of incredibly useful information, and I'm sure it's all percolating and working through. If they come up later, you can always email questions to us as well. We're getting a lot of thank you and appreciation for the presentation.
Thank you so much. I know it's a lot of information that I just threw at you, so yes, it takes some time to digest it all and sit with it.
And then just as a reminder that we are recording this webinar, and we're going to post the webinar recording and the slides on the online portal. So you can access it, you can share it with other staff and team members at your organization and incorporate it into your practice. And then thank you again, more appreciation from participants for the excellent presentation and the sharing of tools as it relates to relapse prevention.
Absolutely.
And yes, we are sharing the slides and the recording in the online portal. So we'll connect with you all on that.
So again, you know, if people are thinking of anything else they'd like to say before we end or ask, oops, see, lost that last slide here. I'm going to go back to the last slide for a minute and just share a couple of other resources that are mentioned here. One is the MBRP website, and that's the first one. And that is, sorry, can you hear me okay?
Yes.
Oh, great. So the MBRP website lists, if you're interested, providers all over the country and also other parts of the world who are offering this program. There's also a research page that lists all of the research studies on the program, which is another resource. And then for people who are perhaps interested in training in delivering the program, we offer intensive workshops. The next one is at the end of May in Washington. It's a 5-day intensive experiential kind of deep dive that's set up like a retreat where you really leave with the resources to facilitate this program in your treatment setting or private practice or wherever you work. So just to offer those resources. And this is the MBRP treatment guide, the manual. We are actually in the process of revising it, and perhaps later this year or early next year, there will be a revised second edition available as well.
Wonderful. Thank you so much again for your time and presentation. And we'll post the slides and the recording online at accesspoints.org, and you just log into your organization's portal account. Under the resource page, you'll find all of these TA recordings. If there's no more questions with that, I'll end the meeting and hope you all have a fabulous weekend. Thank you very much.
Thank you.